everyone. In this presentation, my group and I will be speaking to you all about congestive heart failure, or CHF. Now, what is CHF? According to the Johns Hopkins Medicine website, CHF is a condition in which the heart muscle has become less able to contract over time or has a mechanical problem that limits its ability to fill with blood. CHF can affect one or both sides of the heart, so it can lead to left-sided heart failure and or right-sided heart failure. For the diagnosis of CHF, there are different ways in which you can diagnose CHF, so one of which would be called the Holter monitor. This monitors the heart's electrical activity for 1 to 2 days. You can do a chest x-ray, which takes pictures of the heart, lungs, and other chest structures. You can perform an echo, which is an ultrasound image of the heart. You can draw a BNP lab, which is a hormone that is a marker of severity and prognosis of CHF. You can also perform an EKG, which gives information about the heart's electrical activity. And then lastly, you can also perform a stress test, which this gives information on how your heart performs when it has to work hard. Now for the signs and symptoms of congestive heart failure, CHF can further be divided into left-sided and right-sided heart failure. So for left-sided heart failure, you're going to experience pulmonary edema type symptoms, which could include difficulty breathing, inability to sleep lying flat, sleepiness and trouble concentrating, a dry and non-productive cough, general weakness, fatigue, and then in more severe cases, you will experience pink frothy sputum, which essentially is just mucus that you would cough up. In right-sided heart failure, you're going to experience peripheral edema, which could include swelling in the ankles, feet, legs, abdomen, which is known as ascites, and veins in the neck, which is known as jugular vein distension, or JVD. You can also experience abdominal pain, weight gain and fatigue, an enlarged liver and spleen, and lastly, GI distress, which could include nausea, diarrhea, etc.
Some primary risk factors for CHF include coronary artery disease. This is one of the most common type of heart diseases in the United States. This happens when plaque or fatty deposit build up in the walls of the arteries that supplies blood to the heart, called the coronary arteries. This restricts blood flow, which decreases the supply of oxygen-rich blood to the heart muscles. This muscle in turn weakens and results in heart failure. Also, advancing age. Aging can cause damage to the heart and blood vessels. As we get older, the heart muscle weakens, which increases the risk of heart failure. Heart failure is the most common reason why for hospitalization in people 65 years and older. Also, race, genetic background is associated with an increased risk of heart failure. Whites, African Americans, Hispanics, and Asians have an increased risk. Other contributing risk factors. Some medical conditions can raise the risk for heart failure, which includes valvular heart diseases, narrowing or stenosis, and leaking. Regurgitation of heart valves can lead to heart failure. When the heart valve malfunctions, it causes the heart to work too hard to pump, which leads to heart failure. Dysrhythmias, abnormal rhythms such as AFib, where the atrium is quivering and not pumping effectively, or tachycardia, where the heart beats too fast, can cause a lot of strain on the heart muscles, which weakens the heart and causing heart failure. High blood pressure. When high pressure on the heart muscles can cause ventricles to stiffen and lead to heart failure. Hypertension increases the workload on the heart, causing hypertrophy of the left ventricles, which can progress to heart failure. Also, infections. Pathogens such as viruses, bacteria can invade the heart muscles, which causes heart failure. The inflammation caused as a result of the infection can damage the heart muscles, causing heart failure. Diabetes. With high level of blood glucose, blood vessels and nerves that controls the heart can be damaged. Diabetes also increases the risk of high blood pressure and coronary artery disease, which can lead to developing heart failure. Alcohol use and smoking. Alcohol and tobacco use can weaken the heart muscles, which leads to heart failure. Some other factors that can contribute to heart failure are obesity and a sedentary lifestyle.
For those who are already diagnosed with CHF, surgery may be required to reopen blocked arteries or to replace heart valves in severe cases. Medications are commonly prescribed to help improve heart function through increasing efficiency and/or decreasing workload. Heart diseases are the leading cause of death in the United States. Therefore, it has become a target and primary objective to promote prevention and decrease incidence of death related to these diseases by national health organizations like Healthy People, which is a program run by the U.S. Department of Health and Human Services that sets data-driven national objectives to improve health and well-being over the next decade. With heart disease, there comes a number of other medical issues that can result in poor quality of life, disability, and even death. Therefore, controlling modifiable risk factors is key in working towards prevention, which can lead to lowering incidence in local and national populations. Though just over a quarter of our county is diagnosed with some form of heart disease, we must look at the bigger picture. In regards to non-modifiable risk factors, African Americans have the highest incidence of CHF, followed by Latinos and whites. Our local population is made up of 41.6% Latinos, 31.9% whites, and 8.2% African Americans. This means that 80% of our population is potentially genetically predisposed to developing heart failure. Therefore, focusing on modifiable risk factors is of utmost importance. A third of our adult population in San Joaquin County is obese, and nearly a quarter of our children. 35% of our community drinks alcohol excessively, and 13% are tobacco users. Focusing on education and long-term effects of these substances through outreach and community programs can reduce complications related to their use, as well as inadvertently reducing incidence of heart disease and heart failure in our community.
Patient goals. We want to relieve our patient's symptoms. We do this by promoting cardiac function with the use of pharmacological management. We want to restore the functional status of our patients. We want to return their daily routine and functions without difficulties. And by doing this, we're also going to improve their psychological well-being. We're also hoping to extend survival for these patients. Lifestyle changes and medication can improve patient quality of life.
Comprehensive education and counseling to the community, individual families, and patients is essential in decreasing the incidence of developing risk factors for heart failure. Outside of race and genetics, risk factors for heart failure are modifiable. The good news is, this disease can be contained or at least diminished through the promotion of a healthy lifestyle. Lifestyle and habit changes include avoidance of smoking and secondhand smoke, excessive alcohol intake, weight reduction, regular exercise, restriction of dietary sodium, and a low-fat diet. These are all changes we can make within our daily lives. Also, be sure to schedule annual physicals, preventative screenings, and lab work with your primary physician. A regular annual appointment with your physician can be monumental in the early detection of heart failure. The focus should continue to be on preventing modifiable risk factors from developing, early detection, and the promotion of increased level of education for those who are already diagnosed with heart disease. Use and take advantage of community resources available to you. This is another great way to be proactive and decrease your chances of developing heart failure. Promoting self-assessment and monitoring is a great way to be proactive in your own self-care. You should contact your healthcare provider if you are experiencing these signs or symptoms. Unusual or out of the ordinary shortness of breath, increased fatigue, a chronic cough that does not subside, rapid or significant weight gain, atypical swelling of the abdomen, legs, ankles, and feet. Self-monitoring increases early involvement of healthcare providers.
There are a variety of community resources available to help with these modifiable risk factors, including the Nutrition Education and Obesity Program and the STOP program to help combat obesity and promote smoking cessation. Information on heart disease and heart failure can be found on websites of all of our local hospitals, as well as those such as American Heart Association and County Health Services. Thank you all for watching, and for any additional information that is specific to our community, visit the SJC PHS website and social media pages.